You are welcome. It's Boxing Day, the 26th of December. I hope you had as good a day as possible yesterday, and indeed I hope you're continuing to have a good day today. Now, I want to do a bit of a situation report now, just where are we at as we come to the end of 2020. I'm going to focus particularly on the UK and the United States, but these things apply to a lot of other countries as well. And I also want to look at the spread of this new variant, which is a concern, the progress of the vaccine, and we also want to look at some unusual symptoms to look out for as well. We'll see how we go. We might split it. We'll start and see what happens. So we'll start off with the United States, I think. Now, here's the situation in the United States. Now, we see that the number of cases has gone down over the past few days. This is due to lack of reporting over the holiday period. And we saw the same thing happened here over the Thanksgiving break in the States. But then we noticed things rose sharply immediately after Thanksgiving, as numbers that should have been counted at this period of time were in fact counted at this period of time here. So we'll see the same after Christmas. Unfortunately, we will see a sharper increase. But not only after Thanksgiving did we see this sharp increase here, we saw this continued increase going on after the data had been adjusted. Now, part of this was infections that were picked up during Thanksgiving celebrations and Thanksgiving mixing, particularly amongst families. So there has been a bit of a surge after Thanksgiving, and it's going to be the same, unfortunately, after Christmas. Now, this is the advice from the CDC for Christmas here. The safest way to celebrate winter holidays, don't know why they don't say Christmas, winter holidays is at home with the people who you live with. Travel and gathering with family and friends who do not live with you can increase your chances of getting COVID-19. Or indeed the flu, but thankfully flu levels are fairly low. So that's the official advice from the Centers for Disease Control. Let's look at what actually happened. So here's various data for the states for you to look at. CDC, that was the website we've just looked at there. Now, the Transport Security Agency on Wednesday the 23rd reported 1,191,123 people checking through airport security. And I've seen these videos, and mask wearing was pretty good. I don't know what the ventilation was like in the airport buildings. Probably not always as good as it should have been, but people were awfully close together. Then, of course, by definition, they're close together on the planes. And then they get to where they're going, and there's going to be social interaction. There's going to be staying overnight in people's houses. Basically, it's a situation where there is absolutely guaranteed, spread and increase in cases. There's no way around this, I'm afraid. That's what people have chosen to do, so that's what will happen. Apparently 115 million people were on the move over Christmas. 115 million Americans on the move over Christmas, many of whom we believe staying overnight with friends and relatives. It's not a good situation. So the daily reports in the States, okay, down a little bit because of what we looked at, but the overall figure, now this is from the COVID Symptom Tracker Project from the Atlantic. They're estimating 8.4% increase in the week. So we've seen basically these cases going up for weeks now. This increase has been inexorable in the States. Unfortunately, it just keeps going up. The reported deaths over 320,000 now in the States. So the deaths also, it looks like they're still accelerating. The estimate from the Atlantic was 1.4% increase over the past 7 days. Now, perhaps the most concerning figure is this one. National positivity rate is 10.9%. Now, it varies dramatically from area to area and state to state, but taking the United States as a whole, 10.9% of all tests carried out are coming back positive, indicating there's a lot of community transmission. Therefore, a lot of more cases will become symptomatic. Now, that's down 0.1% in the past 7 days. So basically, that's the same. Its positivity rate is remaining high. Hospitalizations, well, there's 120,000 people in hospitals at the moment. This just keeps rising. Now, if you look at that data at the top of this sheet, I've got the official hospitalisation data from the States, just hopelessly out of date. I don't know why that's not kept more up to date. I don't think it's been updated since November. It really is pretty well ancient history, the hospitalisation data on the official site. But this is fairly reliable from the Atlantic Hospital, the COVID Symptom Tracker project. That's the number in intensive care. That's the number on ventilators at the moment. So hospitals certainly very stretched. And of course, these are just COVID patients. All the other pathology that happens in the United States has not gone away. People are still getting sick from other causes. And it's getting a real problem, a crisis almost. Well, it is a crisis in some areas. Travel from the UK, all airlines, as from the 28th of December, this is a CDC decision. Every passenger needs a negative test for COVID-19 within 72 hours of departure. Now, all this is because of the new mutant or new variant that is in the United Kingdom, and it's more transmissible. And we looked at data a couple of days ago indicating it's about 55% more transmissible than the old form. So the United States are quite right to impose these restrictions. The restrictions apply to anyone travelling from the UK to the United States, including returning American citizens. But of course, you've probably noticed already that for practical reasons, they've had to put this at 72 hours. Well, that's a long time. That leaves people time to be infected from when they take the test to when they get the flight. So this is actually quite a long delay. And some people who test negative 72 hours before will go on to develop the disease 6 days or, 3, 4, 5, 6, 7 days after the flight. Then all the people on the flight will have to be notified and they'll have to self-isolate. I can't really see any other way around that to do it anything like safely. Ideally, of course, people would not be travelling at this time. So the United States certainly concerned about this new mutant, this new change, this 2020 variation, new lineage, the new strain that has evolved. But because the testing in the United States is pretty sporadic, as we'll see later, we don't really know if it's in the United States or not. It's hard to tell, but more on that later. Now, moving on to the UK itself, just look at the COVID symptom tracker data here to start off with. 45,608 new symptomatic cases, and this is up-to-date information. The real number, of course, is higher because that's only symptomatic cases. Particular areas of the country. And here we see this graph of the number of people. This is the prevalence as of the 24th of December. Last time this was updated, the numbers are going up. And in the UK, unfortunately, the numbers are going up really quite steeply. We're not at a good time. There's no question about that. So the average, the 7-day average, which is probably best to look at really, 34,000 new cases per day in the United Kingdom, on average over the past 7 days. And as of the 24th of December, when we think this one was updated, we see that number's already higher. So this increase is going on at pace. South East, 6 million more people added to the Tier 4 restrictions. There's now 24 million people under Tier 4 restrictions. In England, this is just in England, and of course this is basically a lockdown situation, much as the same as we had in back in February, March. Mainland Scotland, Northern Ireland, Wales in their higher tiers as well. Northern Ireland's just returned to a 6-day lockdown. Cases are increasing dramatically in Wales. It looks like in Wales the increase is not as explicable by the new mutation as the increase in cases in London and the South East. So London and the South East has a very high correlation, like 60% or more of the new cases there are caused by the 2012 mutation, the 501 mutation. In Wales it looks less so. In Wales it seems like it might be more behaviourally driven, because the number of the new mutation in Wales seems to be less. Whether more testing is going to change that picture, we don't really know yet. New testing may change that picture. So this is the COVID symptom tracker app here. I'm still filling it out every day. I hope you're remembering to do it as well. Well over 1 million people have stuck with this all throughout and are reporting on a regular basis. And of those 1 million people, 13,244 have had swab tests, so they can get pretty good data from these large numbers. December the 13th, new daily cases, 27,000. December the 18th, 38,000. 24th of December, 45,000. Just do those numbers again. 13th of December, 27,000. 18th of December, 38,000. 24th of December, 45,000. This is a dramatic increase, and the COVID symptom tracker data itself has increased by 44% since the 13th of December. So basically in the last 14 days. UK R value is 1.2, number of infections doubling roughly every 7 days. This is a bit, there's no question, this is a serious increase. Wales, the R value is considered to be 1.3. Reproductive value is considered to be 1.3 in Wales. This is a dramatic increase. This is exponential growth, in fact. Scotland, it is still exponential, but at a lower level. R is 1.1, and London, it says high as 1.4. Cases rising rapidly in the 20 to 49-year-old age group, pretty well everywhere. And cases in the over 60s rapidly rising in Wales. So in Wales, not only are we seeing a fairly rapid increase in the number of infections, we're also seeing a significant increase in the over 60s. That means inevitably there's going to be an increase in hospitalisation demand in the next week or two. And after that, there's going to be an increase in deaths. It's inevitable because of the situation in the over 60s. Right, let's get to the good news from the UK. The Isle of Man is a small island. It's in between, pretty well where I live actually. It's between the north of England and Ireland, the island of Ireland, and it's a tax haven. Lots of ordinary people live there, but lots of rich people go and live there as well, so they don't have to pay as much tax. And it's doing remarkably well. Population is 84,000. This is the total number of cases that they've had. There's currently 3 cases that have been recognised in self-isolation, and there's been no uncontrolled community spread since the 15th of June. Pretty amazing, really, given that I guess it's part of England, it's certainly part of the UK. How has this been achieved? Strict border controls, isolation rules, and there's been essentially very limited restrictions for the past 6 months. So pleased for the Isle of Man. I guess it does show what could have been achieved on a national scale. It's kind of a microcosm of maybe how the United Kingdom could have been if we had instigated travel restrictions as we advocated back in January, February on this channel, but as was not done, as many others advocated, but was not done. The irony now, of course, is with the new variant, we have these travel restrictions anyway. So quite an extreme irony. Now I'm going to leave that there. I've got some other things to tell you. I think I'll put on a separate video though, because I don't want to go on too long. I'll just show you a few pictures. Your experience of the pandemic, which we're always interested in, of course, and various parts of the world. So this is Barbara's experience from South Africa. Public health information, but looks like it's in a closed shop. Quite telling. This is Caroline, who watches in, where's WA? I can't remember. Anyway, WA in the United States. Thanks for watching, Caroline. Animals seem to like me all around the world for some strange reason. This is Liz in London. Good message. Your face covering must cover your mouth and nose. Otherwise, it's much, much, much less effective. Good to see that these signs are not saying wear a mask. That's known now. People know that. It's telling them more how to wear masks. So, progress. I think that's progress. Liz in the city of Westminster. Let's keep making space to help stop the spread. Hands, face, space. Pity they haven't put ventilate there. But I think this must be a public education thing because it's got the cloud of vapours coming out of this lady's mouth. Who's this? This is Mike in California. Add your phone. There's apps all over the place. Pity we're not using them more. Check if there's an app for your area, and I'm using mine. Hope you can use yours. Mike in California also showing the Perspex screens that are all over the place, the hand sanitizer. Of course, what we don't see is the ventilation. Let's hope it's good. Now, this is Paul, who's clearly got a sense of humour and has made a statue. No idea who it's supposed to be, but glad to see you being artistic, Paul. So we appreciate that. Okay, is that the last one for today? That's the last one for today. Okay, we'll post that video now. I am going to come back and do something else on variant spread and vaccination if you want to come back for that, but we'll leave that one there for now. Thank you for watching, of course, as always, and have a great rest of your Boxing Day. And if you've got some time off between Christmas and New Year, that's fantastic. There's still things we can do, of course. Got to be as positive as we can. Don't forget, look around. There's people who are finding this difficult. Let them know you're alongside, metaphorically, if it can't be literally. And if you feel you need help, let people know. You've really got to let people know. Okay, thanks for watching this video.